What is gynecomastia? What are its symptoms? What impact does it have on human life? And how to get rid of this condition? Hello, I am Dr. Vinayak Sutar from Charvi Care Clinic, consultant cosmetic and plastic surgeon. In this video, we will answer all these queries and we will talk in detail about gynecomastia. Gynecomastia, as the name say, gynac means related to females and mastia means abnormal enlargement of breast tissue. So gynecomastia is a condition wherein breast tissues are enlarged due to excess stimulation of uh, or growth of breast tissues. Either one breast tissue or both breast are enlarged. It has also it shows signs of enlargement, tenderness, pain in both breasts. Sometimes, rarely, there is discharge from nipple areola complex. So, what are the cause or what is the cause of gynecomastia? Gynecomastia condition is caused due to hormonal imbalance between estrogen and androgen hormones in human body. So, at what stages does this imbalance happens? Usually, it is physiological or normal in newborns, wherein estrogen is liberated from mother and leads to stimulation of breast tissues. Substantially, it subsides after a few days. In adolescent age group, usually breast tissues are enlarged due to abnormal ratio of estrogen and testosterone levels, where there is pubertal spurt. In some cases it resolves, but in some where there is excess amount of estrogen as compared to testosterone, there is abnormal stimulation or there is excess stimulation of breast tissues found in one of the breast or both the breast in this adolescent age group, leading to symptoms and signs which we will talk in detail. And when person crosses 50, there is a decline in levels of testosterone, which eventually leads to increase level of testosterone as compared to increased level of estrogen as compared to testosterone. So there is growth of breast tissues found in aging people. So why it is important to talk of gynecomastia and what impact does it play? So gynecomastia is a condition where there is negative impact or when there is physiological growth found in pubertal age group. Once self body image is disturbed, confidence level is decreased, and boys, they tend to have eating disorders, they lack confidence, and they will have negative impact both in academic aspect as well as in sport activities, which ultimately leads to disturbance in performance levels, or their performance levels decreases in academic, sports, and also socially they find it difficult to interact with people. They will have excess of shyness. One will have negative body image. Then they will hesitate to participate in outdoor activities like sports, swimming, wrestling, running. These kind of activities they will avoid. And wardrobe wise, one can say boys, they tend to avoid white shirts, t-shirts, per se round t-shirt, where projection of breast tissues are more seen as compared to colored clothes. So what symptoms does patients bring to our clinic? Usually boys or males, they come to our clinic with symptoms of enlargement of breast tissue. Uh, Sometimes there is tenderness of breast. Then uh, due to enlarged breast tissue, they usually pop out in dresses. They feel ashamed of oneself, and they which will lead to decrease in performance. So how to get rid of this condition? So we have to grade this gynecomastia condition into four categories. First one is mild enlargement with no skin excess. Second one is minimal enlargement with no skin excess. Then there is moderate enlargement and with some or no skin excess. And fourth one is gross enlargement with skin involvement, which is ultimately appears as female breast. So treatment is divided based on different categories of or different grades of gynecomastia. Um, and then we'll talk about other causes of gynecomastia. This we talked about hormonal imbalance. There are other causes also, like liver disorders, kidney failure. Then in alcoholism, one can see gynecomastia. Then due to drug intakes, some drug intake, chronic consumption of drugs like spironolactone, flutamide, calcium channel blockers may also lead to gynecomastia. Um, then what is gynecomastia and what is pseudogynecomastia? So gynecomastia is an abnormal or enlargement of breast tissue. Pseudogynecomastia occurs in fatty individuals or obese individuals where there is per se no enlargement of breast tissue, but due to fat deposition one can feel it is gynecomastia. So as name say, it is pseudogynecomastia. So how to differentiate between gynecomastia and pseudogynecomastia? The gynecomastia condition has abnormal disc present beneath nipple areola complex, which one can feel while palpating, and it is compared to hard compared to fatty tissue present in and around breast glands. What is the treatment of gynecomastia? So treatment, there is medical treatment and surgical treatment as well. So medical treatments, line of drugs like SREMs may decrease in gynecomastia condition, but one can get rid of gynecomastia condition and one can avoid its recurrence by undergoing surgery. So surgery depends on grades. If grade 1 condition of gynecomastia is present, then one can directly undergo, or plastic surgeon and prefer to undergo excision of breast tissues. And if the condition or the grade of gynecomastia is grade 4, then plastic surgeon they prefer to undergo, they prefer to perform liposuction and followed by excision of breast tissue. So what is recovery time? Recovery time of surgery is in and around 4 to 6 weeks. Surgery is daycare surgery. Patient gets admitted in morning hours and discharged the very same day. He can resume his work after third day. Patient has to wear pressure garment for 3 to 4 months in order to achieve desirable shape. Apart from this, he has to consume antibiotics and painkillers for 4 to 5 days. Regular visits with consultant plastic surgeon or cosmetic surgeon, and one can get away with all this psychosocial impact occurring due to gynecomastia. It is highly safe surgery. One can visit in morning hours, return at home in the evening without any complications. It is safe surgery. For more information of gynecomastia, one can visit our clinic, DM on Instagram, you can ping on WhatsApp or email us. Thank you.